the historical perspectives of informatics in nursing. The term informatics has evolved from a similarly pronounced French word which refers to the field of applied computer science, mainly concerned with processing of information or data. The computer, which was initially seen as a tool that could be used in many environments, was formally introduced into healthcare facilities in the early 1960s. Although at that time it was used mainly to perform basic administrative tasks like financial management or admission record keeping. But it really was the beginning of computer revolution in healthcare, and soon it became the essential tool in all health IT systems. I'm sure 60 years later we can all acknowledge this. Anyways, moving on to HIT or Health IT or Health Information Technology, it's a blanket term that refers to all the technology that captures, processes, or generates health information. It could be an electronic health record or a mobile app or even a barcode reader. Everything that performs either of these functions is an example of health IT. Now, since its integration into healthcare, computers have remarkably changed the way this industry works. On a day-to-day basis, computers affect the care we provide to our patients in all the ways. It also affects the heaps of documentation we do, the way healthcare providers are educated. In fact, this online lesson itself is the perfect example of how education is affected by computers. Computers also facilitate scientific research process to advance healthcare, administration of various services, reimbursements for patient care, including both for services that are paid out of pocket and also for those that are paid via insurance. With computers in place, we have also seen a number of related legal and ethical implications, and it has served a great deal in the space of quality and safety as well. While doing all of this, we've also witnessed a shift from the use of mainframe microcomputers, also called PCs, to multiple integrated technologies and telecommunication devices such as wireless mobile computers and cell phones. These devices are mainly designed to support continuity of care across healthcare settings. There has also been a dramatic shift from visible to invisible storage devices such as cloud storage, and from developing instructions for old software programs to today's menu-driven touch-screen manipulation methods. Overall, it wouldn't be wrong to say that computers have come a long way. Now, within nursing, we use computers to manage patient care information, monitor quality, and evaluate outcomes. Computers and networks are also being used for communicating data and messages via the internet, accessing resources, and interacting with patients on the web. Nurses are increasingly becoming involved with systems used for planning, budgeting, and policy making. They are also involved in enhancing nursing education and distance learning. Computers are also used to document and process real-time plans of care, support nursing research, test new systems, design new knowledge databases, and advance the role of nursing science. So this was an overview of all the amazing things that's basically happening in healthcare since the computers became part of it. In the next half of this lesson, I'll walk you through the 7 time periods that served as major historical milestones. Remember that at this stage, we're looking at global perspectives. The information that follows is not specific to any one country or region. So the first time period that we're going to talk about is prior to 1960s. That's the time when computers were already developed, but their use started later in healthcare. During this time, there were only a few experts globally who formed a group of pioneers to attempt to adapt computers into healthcare and nursing. Now, it's important to note here that at this time, the image of nursing was also evolving. The number of educational programs for nurses was growing, and nursing practices were expanding in scope and complexity. Basically, there was a shift from nurses being seen just as physicians' handmaidens to autonomous professionals. As mentioned earlier, computers were initially used in healthcare for basic office administrative tasks. They used punch cards to store data and card readers to read programs. Now in 1960s, people began exploring the use of computers in healthcare. There were discussions about why use computers and what should be computerized. Nursing practice standards were reviewed and studies were conducted to determine how computer technology could be utilized effectively in healthcare and what areas of nursing should be automated. At this time, clinical practice also presented new opportunities for nurses. Number of intensive care units were increasing, devices like cardiac monitors and ventilators were brought into practice. Plus, there was this hype about documentation and medication errors. All of this meant nurses needed to become the super users of computer technology. In the next decade, that is through the 1970s, hospitals internationally began developing computer-based information systems. These were initially focused on physician order entry, pharmacy, radiology, and laboratory reporting. Few systems started to include decision support as well. We'll learn about different systems in later lessons, but what you need to know now is that the initial computer systems were not nursing focused. Although it gave nurses a starting point to build their future in this space, and discussions had started by the end of 70s along these lines. In the 1980s, the field of nursing informatics exploded and became visible in the healthcare industry. The overall computer architecture evolved and now included nursing subsystems as well. This was the time when international conferences and workshops started to happen that invited nurses to share and learn about the field. In the 80s, PCs or personal computers emerged. This was a big change. This actually made access to computers easier, affordable, and usable. PCs brought computing power to individual workspaces and patient point of care, even at bedside. Various nursing interest groups were also formalized during this decade. 1990s was all about large integrated healthcare delivery systems. New programming methods were created to link information within and outside systems. There was an increased focus on legal and ethical side of technology. In the United States, Health Insurance Portability and Accountability Act, commonly called HIPAA, brought electronic health records into limelight. Simultaneously, the demand for trained nurse informaticians also increased. In the new millennium, more and more healthcare information became digitized, so much so that some countries offered incentives for healthcare facilities to adopt electronic health records. Hospitals around the world began to go paperless. This, of course, challenged nurses to get involved in not just using, but also designing the systems that worked for them. By this time, we had smaller mobile devices with wireless or internet access, such as notebooks, tablet PCs, personal digital assistants, and smartphones. There was hype about using technology remotely, and so home health care and telehealth applications became recognized specialties. More recently, in 2010s, the field of nursing informatics advanced and new avenues for development were explored. Three critical aspects of this advancement were genomics healthcare, shifting research paradigm, and social technologies. Because of the economic recession, cost became a driving force for all health IT interventions. Most importantly, the whole healthcare industry moved towards consumer-centric systems, that is, placing patients in the center, making them active partners in managing their own health. These were the 7 important eras so far. And I guess this is all for tonight.